Comparison of fluorescent antibody test, immunohistochemistry, and PCR testing for diagnostic confirmation of neurolisteriosis in 25 goats. Introduction. Listeriosis is a well-known zoonotic disease, most frequently caused by Listeria monocytogenes, which affects various species, including ruminants. In small ruminants, neurolisteriosis is particularly common, causing central nervous system, CNS infection, via the bacteria's migration along the cranial nerves after gaining entry through the oronasal or ocular mucosal surfaces. The infection typically manifests as suburative inflammation in the brain stem, particularly in the pons, although it can extend to other regions such as the mesencephalon, cerebellum, and medulla oblongata. Neurolisteriosis in goats and sheep primarily occurs during colder months, often linked to poor quality silage, although other environmental sources of infection have been documented in warmer months, especially in Australia and South America. Affected goats typically present with neurological signs such as recumbency, dysphagia, nystagmus, and circling. The main goal of this study is to compare three diagnostic techniques: fluorescent antibody test, fat immunohistochemistry (IHC), and PCR, for the confirmation of neurolisteriosis in 25 goats with histologic lesions indicative of Listeria spp in the brain stem. These techniques were analyzed to determine which provided the most reliable and accurate diagnosis. Materials and methods. Case selection. The cases used in this study were retrieved from the Athens Veterinary Diagnostic Laboratory, AVDL, archives from July 2018 to July 2023. Inclusion criteria required histologic evidence of inflammatory lesions in the pons and positive results from at least one of the three diagnostic methods, FAT, IHC, or PCR. A total of 25 cases of neurolisteriosis in goats met the inclusion criteria. These cases represented a range of acute and chronic presentations of the disease. Fluorescent antibody test, FAT? FAT is a rapid test widely used in veterinary diagnostics. In this study, frozen tissue sections from the pons were used. These sections were cut on a cryostat, transferred to slides, and air-dried. The tissue was then stained with a FITC conjugated anti-Listeria antibody, specific for the Listeria genus, incubated and observed under a fluorescence microscope. A positive control sample was included in each batch, and a negative control, brain tissue negative for Listeria spp, was also tested to ensure the reliability of the test. Immunohistochemistry IHC was performed on formalin-fixed, paraffin-embedded, FFPE, tissue sections using an automated staining system. A rabbit polyclonal antibody specific to Listeria spp was used, and the staining process included antigen retrieval using proteinase K and the use of a biotinylated secondary antibody. The immunoreaction was visualized using 3,3-diaminobenzidine, DAB, which highlighted Listeria antigen in the cytoplasm of inflammatory cells such as neutrophils and macrophages. Immunolabeling scores were assigned based on the percentage of labeled cells within the inflammatory foci, with higher scores indicating more robust bacterial presence. Polymerase chain reaction PCR. PCR testing was conducted on tissue samples collected from the pons. DNA was extracted using an easy-to-connect automated nucleic acid extraction instrument. PCR primers specific to Listeria monocytogenes were used, and the cycling conditions were optimized for high sensitivity. GAPDH served as a referent gene to ensure the quality of the extracted DNA, and an internal control, IC, was included to detect any inhibitory compounds in the sample. Histopathology. All 25 cases had neurohistologic changes consistent with neurolisteriosis, primarily affecting the pons. The lesions extended to other regions of the brain stem, such as the medulla oblongata and mesencephalon. In some cases, acute lesions were characterized by microabscesses, neuronal necrosis, neuronophagia, and axonal swelling, often accompanied by perivascular infiltration of neutrophils, macrophages, lymphocytes, and plasma cells. In subacute to chronic lesions, the inflammatory infiltrate was primarily composed of macrophages, with fewer neutrophils and lymphocytes, and the presence of glial nodules. Results. Histologic findings. Acute cases. Out of the 25 cases, 17 presented acute inflammation, characterized by microabscesses in the pons and neuronal necrosis. In some cases, there was evidence of axonal swelling and fibrinoid vasculitis, with gram-positive bacilli identified in 8 of the cases using gram staining. Subacute to chronic cases. The remaining 8 cases exhibited chronic changes, with macrophage infiltration and glial nodules observed in the neuroparenchyma. In these cases, bacterial organisms were rarely observed, and the histologic changes were milder compared to the acute cases. Diagnostic testing, fluorescent antibody test, FAT confirmed Listeria infection in only 2 of the 25 cases, 8%, while 1 case was deemed suspicious but not confirmed. Despite the use of fresh frozen tissue sections, FAT demonstrated a high false negative rate, particularly in chronic cases. Immunohistochemistry IHC successfully confirmed Listeria infection in 19 of the 25 cases, 76%, with positive immunolabeling observed in neutrophils and macrophages with an inflammatory foci. Immunolabeling scores were significantly higher in acute cases compared to subacute to chronic cases, P equals 0.048, reflecting the higher bacterial load in more active disease states. PCR confirmed Listeria spp, DNA in 20 of the 25 cases, 80%, making it the most reliable method for diagnosing neurolisteriosis. PCR showed high sensitivity, particularly in chronic cases where histopathologic changes were less pronounced and bacterial organisms were not easily detectable with H&E staining or FAT. Comparison of diagnostic methods, among the acute cases, FAT identified only one of the 17 cases, whereas IHC confirmed 16 cases and PCR confirmed 15 cases. This suggests that both IHC and PCR are more sensitive than FAT, particularly in cases with high bacterial loads. Among the subacute to chronic cases, FAT confirmed one of the 8 cases, while IHC and PCR confirmed 3 and 5 cases, respectively. These findings further highlight the superiority of IHC and PCR in diagnosing chronic infections, where the bacterial burden is often lower. Discussion. Reliability of FAT. FAT, although a widely used and rapid diagnostic tool for neurolisteriosis, was found to have poor sensitivity in this study, with only 2 of the 25 cases confirmed. Several factors could account for this discrepancy, including the possibility that the sample used for FAT may not have contained sufficient bacterial organisms, or the limitations of the fluorescent conjugated antibody, which primarily detects free bacteria rather than intracellular antigens. FAT remains valuable in some settings due to its quick turnaround time, but the authors recommend that it be interpreted with caution, particularly in cases where histopathologic lesions suggest neurolisteriosis but FAT results are negative. The use of FAT alone may lead to underdiagnosis of listeria infections, especially in subacute or chronic cases. Superiority of IHC and PCR. Both IHC and PCR outperformed FAT in terms of diagnostic confirmation. IHC provided visual confirmation of Listeria antigen in inflammatory cells, and its sensitivity was particularly high in acute cases. PCR, on the other hand, was the most reliable method overall, with a high sensitivity in both acute and chronic cases. PCR's ability to detect bacterial DNA, even in the absence of visible organisms, makes it a powerful diagnostic tool, especially in formalin-fixed tissues. Given these findings, the authors advocate for the use of IHC and PCR as complementary techniques in cases where neurolisteriosis is suspected. IHC offers the advantage of localizing the antigen within tissue, while PCR provides a highly sensitive and specific molecular diagnosis. Conclusion. The study demonstrates that both IHC and PCR are significantly more reliable than FAT for confirming neurolisteriosis in goats, particularly in cases where the infection is chronic or subacute. While FAT remains useful for rapid screening, its high false negative rate limits its utility as a standalone diagnostic tool. By incorporating IHC and PCR into routine diagnostic protocols, veterinarians can ensure a more accurate and timely diagnosis of this important zoonotic disease. In summary, veterinarians should consider using PCR as a first-line diagnostic method for Listeria spp, supplemented by IHC to provide further evidence of bacterial involvement within the CNS. This approach will help reduce the incidence of misdiagnosis and improve outcomes for animals affected by this challenging disease.